name is Rachel Salas. I'm a sleep neurologist, board certified in both specialties.
I'm Dr. Virginia Runko. I'm a Johns Hopkins behavioral sleep medicine specialist. Insomnia is difficulty falling asleep, difficulty staying asleep, poor sleep quality, or some kind of combination of those symptoms. And we all have a night of bad sleep from here to there, but really what insomnia is, it's a more long pattern of a sleep problem. That's not only a nighttime issue, but it trickles into the daytime in some way. So there's some kind of daytime symptom, whether that's, it can be just sleepiness or fatigue, struggling to stay awake during work, concentration issues at work, feeling grumpy or moody, or even just having a lot of worries during the daytime about the sleep.
So typically, it's more commonly found in women. However, down from kids all the way up to older adults, we can all experience it at one time or another. And most people have experienced it. When you're studying for a test or you have a very high stakes job interview, you can suffer from some acute insomnia. But when that becomes chronic, usually more than 3 months, and you're experiencing it 3 or more times a week, then it can be actually a sleep disorder.
Insomnia is diagnosed based on what you tell the sleep specialist. So there's no kind of lab test or blood work that you can do to say you have insomnia. They look at your medical history, your psychiatric history, and how you describe your insomnia symptoms. However, sleep studies, the overnight sleep studies, aren't uncommon to do sometimes in insomnia patients because they want to rule out if there's some underlying sleep disorder like sleep apnea that can cause the insomnia.
So insomnia is a complicated sleep disorder because there's always different factors for different individuals that are contributing to it. So the first thing that we look at is to see, what kind of behavioral issues that the patient that may be feeding the insomnia. So things like maintaining good sleep habits are very important, and those are things that we do investigate. A lot of time there's some simple things that patients can change to help as part of the treatment. There's several medications that are available. We typically try not to go straight to those because a lot of times they don't work, and these medications do, they do have a side effect profile, so you have to be very careful and when you give these. There is the mainstay, which is cognitive behavioral sleep therapy, and anytime I diagnose a patient with insomnia, I usually bring in my colleagues as sleep behavioral psychologists because they really help identify what factors are continuing the insomnia, and they help to set up a plan, a treatment strategy for patients to change their behaviors, because that's what the research shows has the biggest impact.